Welcome. Caring well for someone with Alzheimer's or another dementia starts with understanding the condition. In the next few minutes, we'll cover what these disorders are, how they affect our residents, and how we can support them with skill and dignity. Dementia is not a single disease. It's a general term for a decline in memory and thinking serious enough to interfere with daily life. Alzheimer's disease is the most common cause behind most cases. It comes from physical changes in the brain, and it is not something a person can simply try harder to overcome. As our communities age, more of our residents are living with it, so this is care we all share. That's why we say Alzheimer's and related disorders. Besides Alzheimer's, there is vascular dementia, often after strokes, Lewy body dementia, and frontotemporal dementia, which can change personality and behavior. A person can even have more than one type at once. The exact cause matters less than the care we provide. Dementia is not a normal part of aging. Misplacing your keys is ordinary. Forgetting what keys are for is not. These disorders are progressive, meaning they slowly worsen over time, and at present they cannot be cured. But with the right support, residents can still live with comfort, purpose, and joy. The symptoms go beyond memory. A resident may become confused about time or place, struggle to find words, have trouble with once familiar tasks like dressing, or show changes in mood and personality. Judgment can fade, and a once easy decision can become overwhelming. Recognizing these as symptoms of the disease, not choices, is the first step to compassionate care. Dementia usually moves through stages. In the early stage, a person is mostly independent but forgetful. In the middle stage, confusion grows and more help is needed with daily tasks. In the late stage, a resident needs full support and may communicate only through expressions or touch. Our care adapts as needs change. When a resident becomes agitated, wanders, repeats a question, or grows restless at sunset, something often called sundowning, the behavior is communication. It usually signals an unmet need like pain, hunger, fear, boredom, or too much noise. Instead of reacting or taking it personally, we look for the cause, stay calm, and gently redirect to something soothing. Good communication makes everything easier. Approach calmly from the front, make eye contact, and use the resident's name. Speak slowly, in short, simple sentences, and ask one thing at a time. Don't argue, quiz, or correct. Instead, validate their feelings, offer reassurance, and give them plenty of time to respond. A warm smile and a gentle tone often say more than the words themselves. Above all, we see the person, not the disease. Knowing a resident's history, routines, and preferences helps us comfort them and ease hard moments. Keep surroundings familiar and calm. Watch for wandering and other safety risks, and never talk about a resident as if they aren't there. Patience and dignity are the heart of good dementia care. Because this care is so important, Florida requires every team member who works with these residents to complete approved Alzheimer's and related disorders training, with continuing education each year. But the rule is only the floor. Truly knowing our residents is what makes the real difference. Alzheimer's changes memory, but it never changes a person's need for kindness, respect, and connection. Meet each resident with patience and warmth, and you give them the best care there is. This has been a Palace University training. Thank you for caring so well.